So this test is better than the ELISA for early infections. Remember, ELISA, we have to wait for the antibiotics to be made. This test is looking for the organism, so it's better in early infections. A couple studies done by Reinbold at K-State, 3 calves that they experimentally infected, then they came back and they could found that those animals were positive by day 5 to 7. When they ran the ELISA, it took 14 to 17 days for those animals to show that they were positive. So it's going to find those earlier infections faster than ELISA. Another study, 21 days post-infection is when the ELISA became positive. When they used the ELISA, it took 42 days. So again, a little bit quicker than the ELISA for finding early infections. It is comparable to ELISA in the persistently infected animals, and typically those are the population that we're most concerned with. So both of those tests are good for that. We do not know what the sensitivity and the specificity of the PCR is in experimentally infected animals. We've looked all over and we don't know of anybody that's looked at it. We do know it's very, very good, and theoretically, one bacteria in the blood sample is enough for the PCR to be positive. So we believe the sensitivity and the specificity of this test is very, very good. Just as kind of a summary of the 3 major tests, again, we're not going to talk about the gold standard, but the 3 major tests, microscopic examination, PCR, and ELISA, 4 reasons why we might want to use these tests. Freedom from infection, meaning if you're purchasing herds or you're wanting to know whether you're positive or not, what test would you want to use? If we're looking at individual animals, we want to say, is this animal actually infected or is it not infected? Clinical cases, how do we confirm clinical cases? And then prevalence, or how much anaplasm do I have in my herd? So those will be the 4 reasons why we'd want to use these tests. And the microscopic examination test, it really should be left for only confirming clinical cases. Those animals that are staggering, open mouth breathing, those kind of things, that's what that test is actually the best for. PCR, it's best for freedom from disease in individual animals, or also like the microscopic examination to confirm cases. And the reason it's not out here in the herd diagnosis is particularly because of cost. It's $32 versus $8. So it could probably do those, serve those purposes, but it's a cost thing. The ELISA, it's best used for herd screening. So again, if I'm buying a group of animals, or if I've got a group of animals and I want to know whether they're positive, or I have a positive group or not, grabbing some serum samples and running ELISA is the way to go. If I'm positive, and I think Dr. Rethorst is going to talk about the management of it, one of the things you might want to do if you're positive is to know how much is in your herd, because that may sway what management techniques you can use. You would want to use an ELISA on the herd. And we're not talking about, for these tests in particular, that you'd have to sample every animal. You just have to sample a subpopulation to give you an idea whether they're infected or what your prevalence is. A little more about this, and this comes from Coetzee and Reinbold, just personal communications. They've done a lot of anaplasm studies. They suggest that if you're using PCR to decide whether an animal is infected or not, persistently infected, is that you probably ought to wait until 3 weeks after the exposure. So people say, well, when do we know that happened? That would be if it's transferred by insects, then we probably wait until after the insect population has gone away. Wait 3 weeks, grab the sample then to determine whether this animal's positive. For the ELISA, wait 3 to 6 weeks after you think the exposure or the injection or the infection of the particular animal actually occurred.